Here you get personal care and attention, and I think that speaks volumes to the people who come, knowing that in their community someone's coming out and coming out on a regular basis, particularly in this neighborhood. They really appreciate the fact that they're here and being counted and depended on. So you witness that.
So the Division of Community Pediatrics at MedStar Georgetown University Hospital has been around for more than 30 years now, and the Kids Mobile Medical Clinic is our founding program. And with that, we have been in 3 different neighborhoods in DC for almost the entirety of our time. The Kids Mobile Medical Clinic is basically a pediatric primary care office on wheels. So everything that you're going to be able to see in any pediatric primary care clinic anywhere in the country, we offer right here on our mobile medical clinic.
We see somewhere between 800 to 1,000 children per year, and we see kids from birth through their 21st birthday. In the last couple of years, we've been really excited because we've had an increased number of children under 3 years old joining our practice and really being able to partner with families really early on their parenting and child development journey.
Is there anything that we can support you guys with on our side?
So far, no. You guys have been helping really good. Thank you.
Okay, no problem. It's our pleasure. It's so good to see you guys.
It's nice seeing you too.
And kids are doing their normal checkup today, right?
Right.
Perfect.
I'm very grateful for them. They're really sweet. Like I said, I can email them, I could call them. They're responsive. They're like really responsive. So I really appreciate it. Yes.
It really does feel like a family. It's not like you're just coming into your regular doctor's office and everything is just strictly to the point. We laugh. We talk about things that they've been going through. If we haven't seen them in a while, we get to play catch up with them for a bit. We make them feel comfortable.
We love our families, and we are committed to helping them meet their needs. And so building that relationship, it just lets them know that we are there for them from the beginning to the end.
1, 2, 3.
So over the last year, we've been really excited and privileged to enter into a new partnership with Monumental Sports. Monumental Sports is a long-standing partner of MedStar Health, and they were really generous and supportive to become a leading partner in the primary care services that we offer here on our Kids Mobile Medical Clinic. They have similar vision and values to what we do of having a Washington, D.C. that is healthy and thriving for everybody.
Any way that we can be in service to the doctors and the nurses and the employees, I think is really, really special for the partnership that we have. We see our role as uplifting and bringing the community closer together, and that's what these services do in their own way.
You see, can I look at mom's here? You see, oh, I can see your mom too. Oh, good job. Yay. How about this? He's like, okay, that's enough. Let me look at it. Let me see.
We have seen patients for, generations on this van. So you see the impact and they trust you. The accessibility is not just that you can see it and touch it. It's just that it's also that you're in a space where you're seen, you're heard, you're valued, you're respected, and you are receiving the things that will help you help your family.
You want to give me a high five? Yeah.
I really love the staff that work here because everyone has a why of why they're here, and it's really cool to work with people who actually care about what they do, and you can see it in the day-to-day, and you can see it like expressed out onto our families too. Being able to walk out your front door and go on a 5-minute walk around the block and going to get your health care is like such a barrier that's removed, and so it's very important for us to be here and make sure that these people get access to the care that they need.
So a healthcare barrier would be anything that prevent a family from being able to access the health care that they need. And it's different for every family and in every situation. Sometimes it's systemic, sometimes it's geographical, but the core of what it is people are not able to access the health care that they need in order to be able to achieve their optimal health and wellness.
When a family calls or a family is referred to us to schedule an appointment to see us, we want to be able to see them immediately. And so we don't want anything to get in the way of that. So if that family doesn't have health insurance, we're still going to schedule the appointment, and our team is going to be ready knowing that and help those children get on insurance.
Let it go. You gotta release it.
So much love in your family.
Our goal is to deliver the healthcare, but really also understand from families what they want for their children and what their dreams are, what their goals are.
Our families love the additional services that we provide. You know, we are expanding things beyond just the well visit, just your health. So we're responsible for your well-being, and they do see it that way. So they're very appreciative for the additional services we offer in terms of produce delivery or even receiving a farmer's market gift card where they can go shop on their own.
But we also recognize that we can't do it alone, that we need the community, and we've been able to leverage amazing partnerships with community providers who also share our mission.
Dreaming Out Loud is a very interesting thing. We are a farm, a food hub, and a food incubator. So we're growing healthy food at 2 farm spaces here in Washington, D.C., east of the river in both Ward 7 and Ward 8. Through this Food is Medicine program and partnership, there's no cost to families, helping folks stretch their budgets while getting healthier and building more connections around healthy food and community.
We have recently launched a medical, financial, legal partnership with the Division of Community Pediatrics, where we have law students coming onto the Kids Mobile Medical Clinic, and when families come in to see the doctor, they get a public benefits checkup. They get asked about their household needs, about their income, about their bills. They get support figuring out how to manage their financial goals in order to really be able to afford the utilities, put food on the table for their children, and pay the rent.
Okay, let's get your weight. See how much you grow. Is that perfect? Thanks. Okay, let's go into the exam room. Up there. I'm gonna do your hearing test, okay? Can you help me out with this? I would like to say thank you. Thank you, every single one of you ladies. Don't make me cry. But they're really sweet. I really appreciate them. They're really there. I mean, they hear me, everything. So I really appreciate you guys. Yeah. I'm emotional, sorry. But yeah, it's a big difference from when I first came here, then coming here. Difference. I haven't looked for a doctor yet since I've been here, so I'm really appreciative. Yeah.
I've never seen any of this in a pediatric practice before. I've never seen so many different persons in different roles all working to serve our families, again, beyond medical. Yes, including medical, but definitely beyond medical.
How we can address health and wellness from a really comprehensive approach is really what we've been able to do, and we've always been innovative in how we've approached it, and I don't think there's any limit as to what we can do.